Recording in progress.
Hello, good evening. Today we are discussing regarding the successful implementation of infection prevention and control planning. Myself, Pooja, and my group members, Urmi, Mikhlini, and Janika, we are going to discuss this today. So, the first factors, the main factors that influence the successful planning and implementation of infection prevention and control are a robust implementation strategy. Like the management should clearly define a clear objectives and timelines for IPAC integration, and they should establish a dedicated teams with defined roles, and they should regularly monitor progress using key performance indicators, and they should create SOPs to ensure consistency across all the settings. And then the second one is like adaptation process and integration of strategies across all level, including federal, local, and then the facility level. Like they should align all the policies to ensure consistency and to not confuse the workers, and then they should customize approaches to suit specific healthcare environments, like example hospitals for the long-term care and then the short-term care, and then they should facilitate a regular communication between policymakers and then frontline healthcare workers. And then the third one is like spread existence and effectiveness of health systems in each country. Like they should assess the baseline capacity and coverage of existing health systems before starting them. They should before starting the new policy, they should evaluate the existing healthcare systems, and they should strengthen weak areas such as rural or undeserved regions, and ensure the integration of IPAC in both primary care and tertiary care systems. And the next factor that highly influences the successful implementation of IPAC is available resources. And so there are like it is again divided into the financial, human, and material. So when it comes to financial, we should secure adequate funding with for IPAC training, infrastructure, and then materials. And then the human, so they should have an sufficient staffing with proper training. And then the material, they should guarantee supply of personal protective equipment and sanitation tools and waste management systems. And then the existing capacity and policies like beds, ICUs, professionals, and diagnostic labs. Like they should evaluate and enhance the existing infrastructure before planning, and in the planning section. And then they should strengthen the diagnostic capabilities, and then should review staffing ratios and availability of infection control professionals, and they should again review the existing policies and make and enhance them to suit the appropriate healthcare systems. And the most and the important factor that highly influences the IPAC standards is the key support of um, key stakeholders. Like the stakeholder support is vital in this. Like engage leadership at all levels. We can do this. We can get the support from key stakeholders by engaging them in at all levels, like from government officials to hospital management in the planning section, and then resources for and explaining them everything, and then foster a culture of safety among healthcare providers and the public, and then collaborate with professional bodies, unions, and community organizations. And now I'm handing it to the Urmi. She'll be discussing regarding the structure. Thank you.
Thank you, Pooja. Healthcare professionals with relevant skill, training, knowledge, practice, experience, and credentials related to the healthcare IPAC program should be assigned responsibility. What it means is people who are properly trained and experienced in infection control should be the ones in charge of the infection prevention program in healthcare setting. It is very important in the healthcare settings for the people to work there should be properly trained and should be experienced in infection control because it is the key point of starting. Their job is to put the program into action, which is implementing, check if it's working well, which is monitoring after implementing, and look for ways to improve it, this evaluating, which we do after the program is implemented so that we'll know if the program is working properly or not. They do this with the support of senior leaders and infection control committee. Also, the infection control professionals (ICP) should be able to directly talk to a senior manager, someone who can make big decisions and help get things done quickly. Thank you. I'll now forward to Jainika.
Thank you, Rumi. This is Mahalini. So, IPAC elements, the elements of an infection prevention control program must be based on the type of healthcare setting. So, considering its unique risk and patient population, so the key components of the program will also involve and impact the resources of other departments, so such as occupational health and safety, laboratory services, and environmental services. These areas share responsibilities for implementing IPAC measures, including staff safety, diagnostic support, and environmental cleanliness. So next is going to be presented by Jainika. Thank you.
So yes, now we're gonna focus on 20 IPC elements, and we'll be discussing five of them. So first one is a hand hygiene program. So this is a fundamental element. Hand hygiene is the single most effective way to prevent transmission of infections, and this includes proper hand washing with soap, water, and use of alcohol-based hand rubs. As well as it is also important that all staff, patients, and visitors follow this practice consistently, especially before and after any patient contact. After that, the second one is surveillance based on systematic data collection. This means gathering infection related data in structured way, analyzing it and to detect patterns and outbreak, and sharpening the result with those who can make improvements. Surveillance helps healthcare teams to respond quickly and effectively to infection risk. After that, third is precautionary systems. This is this system of precaution in place to reduce the risk of transmitting infection agents. So this includes routine practices like wearing gloves and masks, and also additional precautions when dealing with specific infections. These systems are designed to keep both healthcare workers and patients safe. After that, the fourth one element, which is continuing education for healthcare providers. So the infection prevention is not one time lesson. Regular training ensures that all staff stay up to date with the latest IPSC guidelines, tools, and procedures. The fifth element is education for patients, residents, and visitors. So everyone who enters a healthcare setting plays a role in infection prevention, like providing education on basic practices like hand hygiene, cough etiquette, and when to avoid visiting if sick, helps to protect everyone. So these five elements together build the foundation of strong IC program, and they ensure safer environment for both healthcare workers and the people they care for. Thank you.